Welcome to PACIO Project PFE track for Connectathon 34. We're going to jump right in and start with our demo. Our patient, Betsy Smith Johnson, is a 72-year-old female patient who had an unwitnessed ischemic stroke 2.5 months ago. That means she had a clot in her brain. It was unwitnessed. They were unable to give her a clot-busting agent when they took her to her primary stroke center. And as a result, she had several pretty debilitating deficits that occurred afterwards. She has trouble swallowing, slurred speech, and right-sided weakness, which is her dominant side. This has caused additional functional problems, including trouble eating, trouble bathing, trouble dressing, trouble walking, and trouble toileting herself. During her initial stay, Betsy aspirated on thin liquids, which caused an aspiration pneumonia. This doubled the length of her stay in the hospital and caused a much tougher initial rehabilitation period. Her diet was modified to assist with her trouble swallowing and to accommodate her previous diagnosis of diabetes. Her condition finally stabilized after 2 weeks, and she was transferred to a skilled nursing facility for further care and rehabilitation. She made excellent progress towards recovery during this initial rehabilitation period. As she was preparing for discharge from the skilled nursing facility, she had a modified barium swallow study to see if her swallowing function had improved enough to have a more complex diet instead of pureed solids and thickened liquids. The modified barium swallow study showed that she was still silently aspirating thin liquids into her lungs. And so she needed that continued rehabilitation and the additional therapy before she could have more complex foods. So scene one begins as Betsy arrives home. Her care is provided by her son, her daughter-in-law, and a home health agency rehab team, including a nurse, a physical therapist, an occupational therapist, and a speech-language pathologist. They do an initial OASIS assessment and all of their specific discipline comprehensive assessments as they intake her into the home health agency. These assessment findings are entered into their respective electronic medical records and uploaded to Betsy's electronic health record. These initial assessments, in combination with the modified barium swallow study, show that she still does need that rehabilitation before she can be eligible for another modified barium swallow study to confirm she's ready for more complex foods. I'll pass it over.
So all of Betsy's health data has been stored in the health data manager. And so what this means is as Betsy goes through her continuum of care across all the various facilities, everybody that's providing care for Betsy has access to that same data, that same comprehensive view. So as she's gone, she started at home health, she went to the hospital, then SNFs, and now she's back into home health. And even within that home health environment, there are many different kinds of folks that need to provide care, and they're not necessarily all under the same organization. So everybody has access to that same comprehensive view of Betsy's data across her continuum of care. So we're going to start looking at that data from the health data manager. So first of all, we see the overall summary of Betsy's data. We see her demographics information, her problem list, right? Labs, allergies, immunizations, her care team, and her last hospital visits. We can drill down to any of these details. If we look at her conditions, as we mentioned earlier, she has multiple chronic conditions. She's had different things going on in her life. She's a complicated patient. We can go through any of her details. We can look at her med list, her allergies, her immunizations, vital signs. I'm not going to go through all these, but, but we will look at her first radiology. This is her first barium study that she did, and we see the results of that first barium study. Howard mentioned, we've been looking at her assessments over time, but we'll look at the first assessment that was done in early June. So the first assessment is around her mobility. And if we look at the details of that, we can see that where she stands on her lying to sitting on the side of the bed and her chair to bed transfer. And we can see that she's very dependent on looking at those measures at that point in time. And similarly for her communication status, we can see all of the specifics about her ability to swallow at that initial assessment. We can also understand where she stands on her communication measures. And additionally, we also have, we have these additional pieces of information about her, her attention span, her nutritional approaches, her appetite, and her current food and eating ability. So all that rich information is available to inform care at the point of care. And we also have a care plan. So this is, again, a care plan. It's a long-term service and support care plan, really focused on Betsy's care in the home and particularly during this transition in home care. So the thing about this care plan is it's a patient-centered plan, which is critical because we really want this to be a holistic patient-facing plan. So we have a lot of things focusing on the patient themselves. So these are her strengths. So Betsy is actively engaged in her rehabilitation efforts, which is great. I mean, she's involved. She's been showing continual improvement in her recovery process, and she has really active support from both her son and daughter-in-law where she's currently living. Betsy has some personal goals, and these are more personal goals, but she'd like to stop eating that thickening agent, as she really dislikes the taste, and she's also concerned about the cost. She'd also like to get back to her normal routine and is looking forward to eating normal, healthy meals. So we have this plan that at this stage, it addresses several things. She's going to be getting physical therapy. She needs to be getting speech language therapy, and she needs to be having occupational therapy. So we've created these 3 activities. She'll be getting each one of these 2 times per week during the course of this treatment. We know who's actually performing each one of those details. And we also have a risk assessment. So we have both the description and the risk management plan. So she's at risk for aspiration. And so she's on a modified diet to address that problem. She's also at risk of falling. So they have planned for home modifications to reduce that risk of falling. So with that, back to Howard.
Thanks very much. And as Nancy said, there was also mobility data. And going back briefly to scene 1, Betsy was transferred home via ambulette. This will be an important point later on in the story. An ambulette is a non-medical transport that has a cot inside or a gurney inside because she was too weak at the beginning of her rehabilitation journey to sit up or transfer herself, even with assistance. And so to safely transport her home, she went by ambulette. But now a month has passed since the beginning of her home health stay. She's been home for a month. She's been receiving therapy from each of the different disciplines 2 times a week, and she's made great progress across all domains of functioning. And this information has been entered into the respective EMRs and become part of Betsy's EHR. So all of those reassessments and the rich data from each of the practitioners has once again been uploaded, and the progress has been shared with the entire team. Betsy's speech language pathologist, Maria Gonzalez, enters a recommendation that she undergo another modified barium swallow study to reassess her ability to swallow liquids in particular. And she recommends that the solid components of her diet may become more complex, now moist and bite-sized instead of pureed. She's ready for that more complex diet. The thin liquids still pose a risk, so she needs that radiographic evidence that she's not silently aspirating the liquids. It's an unpleasant test, and it's not one that patients should be sent to before they're really ready, that we know that they're going to pass it. So her speech language pathologist believes that she's going to pass it now. So she writes that recommendation to Betsy's primary care provider, Dr. Anita Chu. Dr. Chu reviews Maria's recommendation and sees the discrete data concerning Betsy's ability to swallow, along with the comparison of these assessments from 1 month ago. Dr. Chu is a family medical provider and not a swallowing expert. And so she agrees with these recommendations and is going to move forward with Betsy's and begin writing orders for Betsy's care.
So we can see earlier I showed you the various assessments that were done in June. Now we'll just kind of review those assessments that were done in July. And so we can see that, where she stands in her mobility. We can also see how these various assessments changed over time. So we can see that if you look at the summary information, initially when we did this assessment in June, we could see that she was very dependent in her ability, lying to sitting on the side of the bed and the ability to move from lying and back to sitting. She was dependent. And now when we reassess, she's much better. She still needs supervision or touching assistance, but there's major improvement. Also on her chair to bed transfer, originally she was dependent and she needs partial moderate assistance in that use case. And similarly, we can see how she fared on her communication. And we can see again in June, her attentiveness was much shorter in duration. Now it's longer. Her attitudes to her dietary regime has improved. We talk about her understanding of simple messages. That's improved as well. And ability to, actually take in the food. She's, much more responsive in that way as well. And in addition to her larynx function and holding her food in her mouth or cheeks, again, she's no longer doing that. Similarly, we have all the summary information about the functions of digestive, metabolic, and endocrine systems, and we see the results of that as well in summary view. And again, we can see that she's making major improvement. And again, in all of these areas, again, we can see everything's improving, all of these various assessments that have been done. So as the care coordinator is working with Betsy, first of all, we noticed that she has a new goal. So she'd like to stop using that thickening agent in liquids, as she really dislikes the taste and texture and is really concerned about the cost. Additionally, as Howard's mentioned, she requires some additional needs. So we have these additional assessed needs, which will update the care plan to reflect that. So she requires another CV study to reassess her ability to swallow liquids. I'm going to be cutting and pasting here, so you won't have to see me adding each one of these. So this is the first assessed need. And we also realize that she needs some transportation to get to her MBS appointment. So as part of that, let me just add this one. We're going to be using the peer surveys to actually evaluate what Betsy's needs are regarding transportation. So that will be ongoing during this process. So back to Howard.
All right. Dr. Chu submits the modified barium swallow study order for prior authorization. She also, while she's waiting for that prior authorization to return, and this is an algorithmic prior authorization, not a submission that will take human review that can take 3 to 5 days. While she's waiting for this return of information, Dr. Chu also takes a moment to perform an additional step to avoid delays in care and prevent additional unexpected costs. She usually sends her patients to her preferred radiology clinic in the same commercial park, but now she wants to make sure that this provider is in network with Betsy's insurance. This is an extra step that she can take so that Betsy doesn't have to worry about organizing this herself or calling her insurance company or calling the clinic itself to make this confirmation. She uses her EMR suite to query Betsy's payer provider network registry and finds that her preferred radiologist, this local radiology provider, is out of network. She then performs another query and finds that another nearby radiology clinic, another provider, another radiologist, is in network with Betsy's insurance provider.
Okay, so we're going to demonstrate that work on behalf of Dr. Chu. So she's opening up her care team for Betsy, and she's going to be adding a participant. Now, what this is doing is actually using the national directory. It's going to be searching against the Palmetto database, and that's who's carrying Betsy's insurer. So we want to know whether or not the particular doctor that Dr. Chu would like to recommend is in network. So we'll go ahead and enter that doctor's name. I'm just going to be putting in last names to keep it simple. And we'll go ahead and search. And so Dr. Chu realizes he's not in network. So this is going to be a good choice. However, she does have another doctor who she very much likes, and it's Dr. Anako. And she'll go ahead and search to see whether or not this doctor's in the directory. And she does come up. This is indeed Dr. Anko. She's with Prism Radiology Associates, which Dr. Chu works with regularly. We have all of her full information available, so it's very easy to add her to the patient's care team. Also, if any of the care teams need to have any kind of notification, it's very easy to select the appropriate folks and make any kind of notification to the care team. Right, with that, I'm going to go back to Howard.
While this was happening, this registry was being searched, data is sent to a Smart on FHIR client, which shares coverage requirement discovery, documentation template and coverage rules, and prior authorization support information with the payer prior authorization server. So this is for the modified barium swallow study to be prior authorized automatically. Within 30 seconds, Dr. Chu receives a response showing that prior authorization is required and was granted. This information is automatically shared with Betsy's home health agency care coordinator, Ray Mancioni.
Okay, so unfortunately, we don't quite have a fancy user-friendly quantifier app yet, but we do have the bones for this back-end logical system that can take in claims, review them, and give back a response very quickly. So what I've got here is, following the PACIO Implementation Guide, a claim submit operation. It's going to take in this claim resource, that's going to show the cost of it, it's for pre-authorization, and a service request saying what it's for. In that case, it's for this barium swallow study for Betsy Smith-Johnson. Other information in this bundle about the organization, the coverage, the conditions about it, but those are the big two things. So I'm going to submit these to a back end that's going to take in this information and give back a claim response. So this shows back the information that you've just sent to me, and then it's going to also include here at the end a claim response. This says, hey, I've got this claim for Betsy Smith-Johnson, and it's queued, and we're going to get to that when we get to that. So you can check on it by hitting claim submit to a claim inquire, and you can pull this endpoint indefinitely to try to get a response back. So we're going to hit this endpoint. We're going to ask about the status. We're going to get the same bundle back. This is going to be still queued, I'm expecting, yeah. So you could hit this, once an hour, once every 10 minutes, as long as it takes. But eventually, you're going to hit an inquire. And after about 30 to 40 seconds here, it's no longer going to be a queued claim response. It's going to be a complete claim response. We've gotten to this, we've processed it, and it's got an adjudication that shows that we've certified the response that you asked for. So here, this is the code that says submitted. What that means is you've submitted a request for an amount, and we've certified that in total. So that claim that you've submitted to us, we've got that amount, and we approved that. We're going to cover it. So that back-end process is, kind of the bones of this FHIR user-friendly application, but we can work towards that now that logic is here, and we're excited to continue moving that forward as we go.
That is super cool because that has historically been a 3 to 5 day process and can end in a no or more information required and then get queued up for more waiting. And so it's really exciting that that information is available right away. So now Ray Mancioni, the clinical social worker and care coordinator at the home health agency, is able to combine this functional and mobility information abstracted from Betsy's assessments and transportation information from a Prepare SDOH screening tool. And he sees that Betsy could be safely transported to her MBSS study via wheelchair van, but that a community-based organization may need to provide that service based on cost. So Ray schedules Betsy's modified barium swallow study, which has now popped into his system only moments later, and organizes transportation using the EHR's referral mechanism, sending complementary functional and mobility information as part of that referral to the community-based transportation service.
All right, and with that, we're going to go back to the ELTSS editor. And as we mentioned, we're going to be updating the various points that Howard mentioned just a minute ago. Cheat sheet so I can copy it. So we have this new activity. We're going to have the modified barium swallow study. So we'll go ahead and add that as a new activity. All right, and we're going to have one study. I think it's this big study. Prison Radiology Associates, right? And we actually know the costing of it as well. So this is going to be $450 for the study. Okay, we've added modified barium swallow study. And additionally, we're going to address her transportation. So we'll go ahead and add that activity. Same date. Say it was life-ray ground transport. So we've added both our modified barium swallow study and our transportation by wheelchair van. I think we know already that she, by looking at her various assessments, that her mobility isn't quite what she would need to have, take an Uber for transportation. So they need to be able to, not only does she need that assistance for transportation, but she needs a particular kind of transportation. She needs to be transported by a wheelchair van. So we've added that specification. And all this information is in her care plan, which is available to anybody else providing care. So we all know what's going on. And I think with that, back to Howard.
Thanks very much. Also worth noting that the wheelchair van is an improvement over the ambulette, right? It's a cheaper form of transport. It's just as safe because she's able to be transported safely in a wheelchair. And so this is an upgraded improvement in her care. So Betsy is safely transported to her modified barium swallow study via wheelchair van. Her son accompanies her and serves as her advocate. The procedure proceeds as expected and shows that Betsy is no longer silently aspirating liquids. These results are sent as discrete pieces of information to both her speech language pathologist and primary care provider. Betsy is safely transported back home via wheelchair van. The EMR pulls the data from the health data manager server. The speech language pathologist uses the results of the modified barium swallow study to write new recommendation for Betsy's care, including a recommendation to increase the complexity of Betsy's diet to include thin liquids and moist and bite-sized solids. Betsy's primary care provider receives these results and recommends and then writes corresponding orders to align with them. Betsy begins to drink thin liquids. This is a major quality of life improvement for Betsy, and she is able to enjoy a wider variety of foods and textures. This leads to a better appetite and motivates her to continue with the difficult rehabilitation process. It also alleviates a financial burden of the expensive liquid thickener that was not covered under her insurance program. So what are the accomplishments of this track? We coordinated a fairly complex interdisciplinary care team and their findings. We provided decision support to the primary care provider and eliminated billing surprises by leveraging in-network providers. We eliminated days of delay around prior authorization determination. We facilitated efficient and cost-effective care coordination and updated her to a more appropriate level of transportation. We facilitated appropriate reassessments and the coordination of that information for that interdisciplinary care team. And most importantly, we facilitated quality of life improvements for Betsy. And we did so in a way that didn't subject her to extra or needless tests. We had her assessed at the appropriate time, so she only had to go through one of these unpleasant procedures one additional time, and we made her life better.